Singapore is tightening border controls for non-Singaporeans and permanent residents arriving from India as the COVID-19 situation there worsens. Effective immediately, entry approvals are being reduced. And from Friday, people with a recent travel history to India will have their stay-home notice extended by 7 days, on top of a 14-day stay at a dedicated facility. Almost half of all imported cases in Singapore over the past week have come from India. If suitable, travellers will be able to serve the last week of their SHN at home. They'll be tested for COVID-19 twice, after 14 days and again after the full 21 days.
We're seeing patients coming from South Asia, where they stretch an infection up beyond the 14 days of SHN. This is a feature of the mutants. This is to increase the transmissibility. If you add in the expected 21 days of incubation period of the virus now, we are going for a much longer period. So the government's plan to introduce an additional 7-day stay-home notice is a wise move. It is actually adapting to how the virus is mutating.
Additionally, from Friday, arrivals from Hong Kong will have their isolation period halved to 7 days, with an option to serve it at home. They'll also have to be screened for COVID-19 at the start and end of their 7-day SHN. Separately, long-term pass holders and short-term visitors with a recent travel history to the United Kingdom and South Africa will be allowed to enter Singapore. They must serve a 21-day stay-home notice. And transit passengers from both countries will also be allowed. The move is part of the multi-ministry task force regular review of Singapore's broader measures. Also from Friday, people who've had both shots of a COVID-19 vaccine can travel to high-risk places for critical and essential official travel. They will still be subject to testing and self-isolation.